हेलो गुड मॉर्निंग। मैं से डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के प्रीवियस ईयर क्वेश्चन पेपर। अ 45-year-old man presents to the OPD department with symptoms of headache, renal stones and abdominal pain. Serum calcium is low and PTH is high. Which of the following hormones and associated disease might be causing this symptom? Parathyroid and primary hyperparathyroidism, catecholmine and thyroxine and hypothyroidism, mineral and bone disorder. Here the question says the abdominal pain, serum calcium is low and PTH is high. The answer is a mineral and bone disorder. Because the low calcium levels and elevated PTH levels indicated mineral and bone disorder in chronic kidney disease, mineral and bone disorder, CKD, MBD, essential changes encompasses by the hyperphosphatemia and hypocalcemia, deficient serum vitamin D levels, and heightened secretion of parathyroid hormone, and in secondary hyperparathyroidism. Next question. A 45-year-old man present to the OPD with proximal muscle weakness, purple stretch mark, obesity, and easy bruising. What is the underlying condition? Hyperthyroidism, hypercortisolism, hyperparathyroidism, and hyperaldosteronism. Here the questions are the OPD dependent upon muscle weakness, purple stage marks, obesity, easy bruising. The present suggests of the Cushing syndrome. Which feature of the hypercorticolism? Weight gain is the symptoms of the weight gain. Purple stage, proximal myopathy, hypercorticolism is the underlying condition. In Cushing syndrome, it's primarily caused by chronic overproduction of cortisol by the adrenal gland, often due to the adrenal or pituitary tumors. Pituitary dependent on the cortisol axis, termed the Cushing disease, accounts for about 80% of the cases in the Cushing syndrome. Next question. A 30-year-old male is admitted to the medicine ward with complaints of vomiting and diarrhea. Lab investigations reveal a serum potassium levels of 3.2 mg per liter. All of the following can be sign of underlying dyslipidemia except ventricular tachycardia, quadriplegia, diabetes insipidus, and cerebral edema. Here the given scenario patient was hypokalemia. Cerebral edema is related to the other is the cerebral edema, because the cerebral edema is related to the fluctuation in the value of the sodium. Hyponatremia, potassium does not play a role in plasma osmolality, hence do not cause the cerebral edema, because question asks the accept. Next question. All of the following are criteria for diagnosis of diabetes ketoacidosis except serum glucose of more than 250 in iron gap, 10 to 12 serum bicarbonate less than 50 mmol, serum potassium level than 3.5 mq. The correct option is the serum potassium less than 3.5 mq, because the serum potassium level 3.5 mq can occur in the diabetes ketoacidosis, but but it's not a part of the diagnostic criteria. In DKA, patients are often potassium depleted, yet plasma potassium level may not fully indicate a total deficient level. Initially levels might be elevated due to the factors like water loss, potassium shifting, and however treatment can lead to a rapid drop in plasma potassium due to the fluid dilution, insulin induced movement into the cell, and ongoing renal loss. Next question. A 45-year-old male present to the OPD with complaints of daytime sleepiness and nighttime sleepiness. His wife reports that he snores at night. Which of the following statement about his condition is incorrect? The tone of the pharyngeal muscle is increased is the incorrect option. The scenario here the scenario depict the obstructive sleep apnea in individual with a collapsible airway, reduced muscle tone, and leads to the brief pharyngeal collapse. Apneas uh, are the near collapse hyponias. These episodes are typically end with the ventilatory reflexes and promoting aerosol, increasing muscle activity, and reopening the airway. Collapse can occur at various sites, including the soft palate, most commonly the soft palate, tongue, base, lateral pharyngeal wall, and epiglottis also. Next question. A man present to the emergency department unconsciousness and hypotensive. His ECG reveals narrow complex tachycardia. What is the next best step in management? Synchronized DC cardioversion, carotid massage, intravenous adenosine 6 mg, intravenous amiodarone. The correct option is the synchronized DC cardioversion. The given scenario points toward paroxysmal supraventricular tachycardia. In any unresponsive patient with acute onset tachyarrhythmias, except for the atrial fibrillation, the next best step in the management would be the given synchronized DC cardioversion. Next question. A 45-year-old female present to the emergency department with breathlessness. She has a history of a viral infection and chest pain from 7 days ago. A chest X-ray reveals a water bottle hurt. Which of the following statement are to accept? Here, the in the described scenario, viral pericarditis that is initially occurred, progressing to pericardial effusion and subsequent diastolic collapse of the ventricles, resulting in cardiac tamponade due to the presence of fluid surrounding the heart. Muffled heart sounds are expected rather than a loud S1. Here the answer. And in pulses paradoxes like the characteristic by a drop in blood pressure of more than 12 mmHg, more than 12 mmHg during the inspiration. Inspiration is a feature of the cardiac tamponade. In emergency, pericardiocentesis may be required. This statement is true or pericardiocentesis is performed as in the emergency measure as there is diastolic collapse of the ventricles. In ECG shows the RA and RV collapse requires immediate intervention. This statement is true. There is a diastolic collapse of ventricle in cardiac tamponade. Diastolic collapse in cardiac tamponade. Thank you and keep revising.